Assalamualaikum warahmatullahi wabarakatuh. The first, I would like to introduce myself. My name is Rahmaya Handayani. You can call me Nova. Thank you for this opportunity. Thank you for the committee. Give me two presentation the result with the title The Role of Education in Post-Anesthesia Patient of the Comfort. Introduction. NCT pre-operation is 60 until 18%. 5% is severe NCT. Many studies have been found on a pre-operative education. However, research related to post-operative education is still very rare and get less attention. We can see, based on the last study, NCT after surgery 3.75% in severe NCT, 10% in mild NCT, 25% moderate NCT, and 61.25% were not NCT. NCT after surgery shares attention by the health team because this NCT will affect the patient recovery process. NCT causes post-operative discomfort both in the recovery room and in the ward. How the methods? The research was an R&D research that consists of three sets. This research was the third stage, namely the experiment state, placed in Margono Soekarjo Hospital in Purwokerto. How the design? The research used design, a pre-post group design, with the population surgical patient visit for our mount around 1,500. So with the sample 96 patients with the inclusion criteria. Patient experience parameter was used to picker patient experience questionnaire or PPA, which consists of 15 questions. Certification or self-qual questionnaire was used with the 12 questions. And education from anesthesiology using booklet at a reference and a checklist format is given to patients with humanist in post-anesthetic. How the result? Based on table 1, how the frequency, the respondent characteristic is the majority female, 44%, education, the majority senior high school in 36.5%, income, in middle income, the majority 48.9%, and last, how the job, the majority work 70.8%. Based on table 2, how the level of certification before and after postoperative education anesthesia, we can see majority certified before and after is very significant. So p-value with p-value 0.00, and the majority certification in after the post-operative education and anesthesia based on certification is 57.3%. Based on table 3, how the patient experienced before and after post-operative education and anesthesia, we can see in table 3, before and after education post-operative in anesthesia, p-value 0.00, the majority in presentation in very certification 62.5%. The discussion. There was a significant effect between certification and patient experience before and after surgery in anesthesia education with a p-value of 0.000. There, there was a significant effect of postoperative education and anesthesia on the level of patient comfort. Socioeconomic can affect a person's certification. Economic status include education, employment, and income. People with a high income will have a positive perception of their life. Income has a significant positive correlation with life satisfaction and happiness. The result of this study also provide additional contribution to the literature of the effect of financial condition on life satisfaction and psychological well-being for each individual. How the education? People who have higher education, formal or informal, will have broader insight. Low level of education for the lower certification. So, patient certification is obtained from the excellent quality of service from the hospital. Conclusion. There was a significant effect of postoperative education and anesthesia on the level of patient comfort. Thank you. This is the authorship. This is me, Rahmaya Handayani. This is Dr. Hamza. This is Miss Ika Yuni Widyawati. This is Mr. Edi Prayitno. And the last author, this is Mr. Aryadi Arif. Okay, thank you for your attention. The last, I'm say wassalamualaikum warahmatullahi wabarakatuh.